Hey guys, welcome back to Chris and Retro. Tonight's video is going to be the start of probably an ongoing work that I do on this channel, and I'm going to be dealing with an issue that's not really talked about, and I'm not really sure why, and I'm not 100% sure why it is. I didn't, get on this bandwagon before, but I guess this is what happens when somebody messes with somebody you love, and so there's going to be a lot of personal rigor, I guess, in the things that I present, but also I'm going to make sure that this is about exposing fraud and exposing abuse of patients. And so there's a lot of work that's done about it in a traditional hospital setting, but very little is being said about what's going on in our addiction and mental health treatment facilities behind closed doors. We've had exposure recently in here in New York in a prison that a man that I shared on the channel here had been beaten to death by COs. It's been going on for years there with an exact same crew of men, and they only were exposed because of cameras. Unfortunately, in treatment facilities, there are no cameras that are getting public access, and as a result, there's a lot of things that are going on in a 24-hour day in a residential facility that is inhumane and against what you're supposed to be doing when you're helping others, and you're supposedly dedicating your life to helping others that are trying to recover from addiction for a wide variety of reasons. And so on this video tonight, I'm going to expose some basics. I'm going to start the subject matter. It's not going to be in every video conversation, but I am going to continue to dig on this thing, and I'm not letting it go. And I'm actually going to put on notice one specific facility. I'm going to call them out by name, and they should be aware that there's nothing that I won't do to make sure that what's going on behind closed doors is exposed. So with that, let's get started. So guys, the headlines that go out all the time are addiction, overdose, opioid crisis. Then we hear about lawsuits against pharmaceutical companies because they're the reason. And then we hear about the noble enterprises of our treatment communities, which I want to qualify one thing. There's a lot of really good workers out there. So I am not crapping on the entire industry, but I am going to call out specific things that are actually happening, and somebody has to do something about it. And I decided to be a voice for that, mainly because it hurts. It's hurting as I speak right now, somebody I love very much. And they use systems around them to get away with this nonsense. And so I'm going to expose some things that I'm aware of, and I will continue to dig in this and continue to pursue this information as much as I can give you substantial information more. But tonight I figured I'd kick it off with it, just kind of first shot fired, so to speak, if that's the way to put it. So that, like I said, the headlines are about lawsuits and winning lawsuits. And some of my work with the nonprofit Shatterproof is as an ambassador with them, what we try to do is make sure that the money that was won from those lawsuits and the opioid, to help deal with the opioid crisis, is that money would not go into general coffers of states, and that it would actually end up in the treatment providers' hands. So with that, I've done work advocating for treatment providers to make sure they have the money and resources to take care of the people that I love, those that I've walked next to that have addiction problems, and myself included. But there seems to be a hierarchy because with the opioid crisis and with all this noble headline saying that we're out for the people that struggle with addiction to heroin and cocaine and things like that and fentanyl, the alcoholic is, not considered as bad really by our society, I don't think, unless it's, somebody that's in your home that you're just sick of dealing with, or you're a drunk driver. But we say that we're here to help them, and we want to look out for them and our sons and daughters and all those things that should be said. And the last place that they should be abused is the place that they're going, that our families send them to, or legal systems send them to get better. And lo and behold, just like we found out in long-term cares during COVID, long-term care facilities in COVID, like we've seen recently in a New York State prison, where an inmate can be beat to death, and if it wasn't for cameras, that one time wouldn't have been caught, and versus the many other times that's happened. There has been no expose on any significant scale exposing what actually goes on in long-term treatment facilities. And tonight I'm going to make sure I expose what I know to be true, and I assure you that I will not let this go. We have a couple things that are being dealt with in the treatment society and things that I do support. So the work that I have with Shatterproof is to make sure that stigma is being removed from people that are struggling with addiction. Now, granted, there's many of us that when we're in our throes of addiction, many don't get better because there's a lot of things going on in the person that's struggling with substance use. And some people are just not willing to get better. And regardless if it's substance use or something else, they've lived bad lives and they've done bad things. So, for example, somebody that preys on children, addiction, no addiction, has got something else going on there too. And those are all mental health issues, character issues, and deviant behavior. So I can understand why there's burnout because it's a difficult population to work with. At the same time, to get qualified and licensed to be a qualified counselor is extraordinarily expensive relative to the ratio of pay you get in return. So when you go into that time of work, you're going to spend extraordinary amount of money on education to get the certifications you need, but yet you're going to be working in a quasi-medical field, having the same hours and rigor that you would if you were in a more traditional medical field. You have the exact same bills, but your pay and your benefits and things like that are a lot less. So there is a disparate pay scale and everything for those that work in the addiction community versus working in another community. And a lot of it has to do is because most of them are nonprofits. So with that comes a lot of regulation and those types of things. Regulation is supposed to be designed to make sure that there's no fraudulent billing, that programs are consistent and measurable, so that especially as of late, as they try to get ahead and find better, more evidence-based treatment for somebody, so that when you walk through the door, a lot of times the first time they've even seen medical treatment for many of them. So many people find out they've got cancer or serious dental problems or other things that are going on in their lives. And they weren't able to ever see that because their addiction had taken most of their life. And most people were just looking at them as an addict and not as a human and your total health. Now that premise and that setup is really where addiction treatment should go. And I know a few providers that are really focused heavily on that. But then there's the other side of this. There's the other side of it. And, unfortunately, a lot of the population that's being moved into the recovery community is not the highly educated, that have gone through all these years of education and been trained in specific ways. Many of them are lower level educated people that this is their first real job. They are clean and sober, had a history with addiction, and now they put themselves in a position of power over somebody that's struggling. And what I mean by power is they're in a supervisory role over their behavior in a residential facility. Now, I'm going to carefully navigate this because I've got some stuff going on in my personal life that I don't want to disrupt that with this first shot. But it is not going to be the end of the conversation by any means. I'm going to use this platform. While this platform is designed to show you high-risk living is going to cause you problems and that hope is available, it's closer than it seems, sometimes you got to pick a fight to find hope for those that you love, and that's exactly what I'm doing tonight. So tonight, no question about it, this video is to inform you about information, but to notify those that are doing this to people, especially somebody that I love, that I am going to make sure that you are exposed for what you are doing. And it is not because I'm so in love with the person that you're hurting that I believe anything that's being said. That is not the truth. I understand exactly how things go, but I happen to know this person very well, and I know exactly what is going on. And I also know what should be going on in this specific facility, and it caused me to do some research to see how prevalent this type of thing is, and I found out it's extraordinarily prevalent. So I'm going to expose the program and what it is that we're seeing. Now, a good program that has treatment in mind and better days in mind for a patient or a client, as they call them, that client is going to come in, and in the current models, the good ones, and we've got a regional treatment provider here that I've had some affiliation with that I think does a really good job of, at least from the CEO down, has created a vision that wants to look at a client as a person that needs to get help in all capacities. I also know that locally, Rochester Regional or Rochester General, they have treatment facilities that are tied to them, and they also look at the total health of a patient. And having been one of their clients, I find them to be tremendously thorough and also very much act like my regular medical doctor in terms of getting referrals. And if you walk in and you've got a problem, if they're not the specialist in it, there's a referral system set in place so that the appointment's already set before you leave, and it's really done well. And I see some treatment facilities do that very well because they're looking at the client as somebody that's struggling in a lot of ways. Many of them are legal, financial, education-wise, medical, above and beyond all the addiction and mental health stuff that's got to go on. Then there's those that take in people to fill beds for revenue to pay for their facilities and pay for their salaries. In there, they sprinkle that in with people that are underperforming personnel that probably couldn't hold a job in the real world and are basically mall cops in a treatment facility. And that's very much what's running this program that we're in. And there are names of people that I will call out on this show. There's no accountability in facilities like this. There's a lot of favoritism. There's inconsistencies all over the place in terms of how they treat people. And what's interesting is that if you know another treatment provider in the area and there's a facility like this behaving this way, it's well known in the treatment community. It's well known. In fact, Barrington, which is a part of Catholic Charities in Rochester, New York, has a brand new facility. And in that brand new facility, they have a reputation of doing bad things, doing wrong things, doing inconsistent things, doing non-clinical things in the name of treatment. And in actuality, all they're trying to do is keep beds full. And so they'll jerk people around and ruin their lives. Now, one thing that as a treatment provider that you always have to understand is that you're not in control of a person's substance use or their well-being or necessarily their own behavior. However, you should not create an environment that creates such a depressive event in their life that it could lead to impairment. And in this case, and in this facility, the way they manipulate people, they can cause people major depressive events that lead to impairment. No treatment facility should add another layer of trauma to an addict that is a trauma-based addict. They should not be creating traumatic circumstances. And this facility, Barrington, creates traumatic circumstances in people's lives, and we have documentation supporting that. Now, for you, if you have a loved one that is going into treatment and you have, well, man, hopefully this is the time that they're getting better. You are not a hostage. Be a voice. Advocate for yourself. Have your loved one advocate for themselves the very best they can. Now, where it gets complicated, especially if you've got a child protective services involved or something like that, they're looking out for the well-being of the child, and they have to trust that these professionals are telling them the truth. When in fact, in many cases, you have underperforming individuals not telling the truth. They're using anecdotal evidence. They're hearing other clients' words about things. They'll have RAs that are nothing more than mall cops like Carmen. They complain about people's sleep patterns, but will shine flashlights in their face at night just to be obnoxious to mess with them, to stir them up more. They'll do it under the guise of breaking rules too, but create an environment where that's gray anyway. But when they want to get somebody, they'll stringently enforce those rules for a few, not all. And then when they give you some grace, they'll use that as a weapon. Now, God forbid, I'll warn you now that if you do try to stand against some of these institutions, they insulate very well, and they try to come across as the one that knows what's going on, and the addict is just a liar and just a junkie. So I'm not saying that people in addiction in those facilities don't manipulate things at times, and I'm also not saying that everybody there is honest, because let's get real. Addiction is the greatest of all thieves, and it steals through lies and manipulation in a lot of ways. And we do it to ourselves. We're our own biggest liar. I was my own biggest liar. I hesitated doing this show because I think it's really easy for us to get mad when our loved one's not getting better. But we always seem to blame other people and take their inventory. In this case, I'm not taking anybody's inventory. I took the time to pause and seek evidence. And it's overwhelming to me how fraudulent this facility is, as well as many others. Now, I'm going to share something with you just to make sure that this isn't just a personal rant about a personal offense. I looked it up just to make sure. And so this is just one side of it, but this is an example. I looked up, okay, healthcare fraud in addiction treatment facilities. So this one is put out by Association of Certified Fraud Examiners. So in here, we're talking about fraud, waste, and abuse schemes in addiction treatment. There was a government accountability office put together for this, and it was for a high-risk list of those that are at high risk of being susceptible to increased fraud, waste, and abuse. So there's a organization and several organizations that are not only investigating healthcare fraud and things like long-term care facilities, which we learned all too well during COVID or during the pandemic. Now it's very specifically looking at substance use disorder. And why is that? Well, if you think about somebody that has no support system around them, they burned every bridge, they're struggled with addiction most of their lives, who's going to call these people out in this? So they put together schemes like fraudulent schemes where they're going to refer people, and they opulent programs. And that's one way they do it. But the other one they do is, first of all, it says when a healthcare fraud occurs in a variety of healthcare settings, such as laboratories, dentist offices, home care, health agencies, pharmacies, transportation, like Medicab. I'm not saying Medicab is, but that's an example of transportation. What distinguishes fraud, waste, and abuse in drug use disorders, the SUD treatment sector is expected to continue growing, reaching a value of 3 to 34 billion. Only 2.7 million of the 41.1 million persons who need treatment for substance use disorders during the course of the previous year received it, and specifically treatment center, according to 2020 National Survey on Drug Use. So this is a 5-year-old survey, and it was happening then. This was citing a specific case and about a large-scale insurance scam. So that's one element of it. There's agencies collaborating to defraud. And then there's a fraud scheme in sober homes. There's examples of fraud schemes in addiction treatment. And one of those in here, they're talking about a prescriber, a physician fraudulently billing. And so I'm going to pause on that one for a minute, because that's one of the areas I'm going to talk about. So if you have a loved one that happens to find themselves in a treatment facility, one of the things that has to happen is there has to be a treatment plan, and whoever has a consent should be able to have access to that. And certainly the client should have access to what the treatment plan is. Why? Well, one of the things I've attested to on here the entire time is that part of our good living is that MAP process, your mindset and your action plans, and then your promises kept. But your action plans, that plan shows you what the gates are that you should cross, so that you yourself know you're making progress. A big win for somebody in recovery is to feel like they're making progress. Now, there's two things that are absolutely destructive to somebody in recovery, or even an active addiction. Feeling there's no progress and no hope, because progress tends to feed hope in a lot of ways. And the second one is isolation. I'll hold on that. So with this fraudulent billing that I'm talking about, there should be a treatment plan in place. And through that progress, there has to be notes and documentation of the progress. And that patient or client should be able to progress through the program based on their completion of the performance required or agreed upon in the treatment plan. Many cases, patient-centered treatment has the patient involved in what that treatment plan is. It's very common and should be the way procedures go. Now, I understand that different treatment facilities in different states have different ways that they look at this. Not all of them look at it the same, but neither here nor there. If somebody is in there as a billable patient, that patient is only to be billed on services rendered. And the only way you know those services are rendered is at the basis of a treatment plan that shows those services are being rendered through completion. Now, in the specific case that I'm speaking of, we have a situation where there doesn't seem to be a treatment plan, or at least one that they're willing to disclose. They're making allegations outside of the treatment facility that are causing my loved one to have problems accessing her children. Same treatment facility has graduated her to the point that she had free reign throughout the days, and in the entire time has had not one positive screen. Not one. But then started to have some open beds and nobody to fill the beds, and all of a sudden she starts getting a lot of hassle. Discharge dates set and counselors not showing. These types of things. Interestingly enough, this counselor has been written up for the performance with a specific patient, And her name starts with a T. Remember, my name's Chris T. She has decided to be inconsistent with her performance of her duties on the job. And I had to advocate as a loved one to get some involvement and exposure to some erroneous reports that she put out that put their client in jeopardy of losing her children with no documentation and completely false. So here's one tip for you. If you have somebody that's going to a residential treatment facility, not an inpatient treatment for the early on stages of addiction, the 40-ish days ones, but if they're in a long-term residential program that has gates where they can start working and doing those types of things, make sure that your loved one has a third party that is actually their prescriber and mental health and substance use counselor. Make sure that they have an outpatient program that they go to that is their actual treatment provider, not the residential facility. That's the only thing that has saved us in this situation, because we have a residential, we have an outpatient program that is completely opposite, to the point they've even said it's almost as if they're reading somebody else's chart, even though the science and the test results are exactly the same. In other words, the performance is good for both parties based on the science of the labs and of everything else, except for these erroneous comments that are being made. And so then you have to do some digging to find out where they're coming from. Now, I talked about skilled workers, and so you have bad employees everywhere, but in the treatment community, unfortunately, you'll find a lot of bad actors, a lot of people that for whatever reason are in the work or probably weren't qualified to be working with people yet because their own demons haven't been dealt with. You'll find, because the pool is so limited for people that will work in this work, that they've actually laxed the requirements. And so you'll often have somebody that's working as a peer or working in these facilities as a resident assistant that has less than a year of sobriety themselves. Now, for those of you in recovery, less than a year of sobriety, you're hardly somebody that should be monitoring and mentoring somebody else. You still could easily fall back into some of those behaviors if you find yourself in that environment. We've found that to be true with 2 RAs at this facility and one by the name of Carmen. They bully and they use their power to manipulate with no care for consequence or outcomes. In our case, it's caused some pretty serious outcomes. It's caused some very serious outcomes that we now have to go through extenuating circumstances to show these are not true. Fortunately, we'd had enough pieces in place accidentally that allowed us to understand what the truth was, and now we know the truth. So what they can't do is you can't bill for services not rendered. And if the services are rendered, they have to be documented. If they're not documented, it's fraud, period. And from my estimation, based on the evidence that I have to this point, we're in the middle of a fraudulent situation. This is the actuality. And I will continue to name names as we go through this, because I've never liked bullies, and I certainly don't like it when they mess with my family. And, we are compliant, and we're doing the very best we can possibly do with the circumstances in a lot of ways that we've created. But this is where it starts to get real ugly, when people start doing stuff that's completely wrong for God knows what and whatever's going on in their life. These supporting documents that I shared with you just now show me that there is a wide range of fraud in the recovery community, in the treatment system, a wide range of it. Laziness or untrained, I have no idea. I worked for a former CEO in there that's adamant about constant training, and I never understood why she was that way. But man, I am on board with what she's saying, because people are not getting how serious this is. And in this facility, Barrington, part of Catholic Charities, they don't seem to care. They do a very good job of covering up. Between the house manager, a few of their counselors, and a few of their RAs have a nice little racket going there. And it's a brand new facility, but their reputation is known in the local community to other treatment providers. It's just not been exposed, because that's not what you do. It's tough work. And for those that are doing a good job at it and doing the right thing, I applaud you. And those that make mistakes, honest mistakes, that's fine. But here's what happened with this one. They were found out to be wrong and proven to be wrong, and we started to ratchet that up. So I got the Justice Center involved. Well, the Justice Center has determined that they don't deal with discharges, and so they viewed that my case was more about a discharge date, and in actuality it was much more. And they referred me to the state representative, which I'll be contacting. But there are resources out there, and I have many of them because I've been in this for a while, and I'm going to be reaching out to all of them. Now, this show, I definitely don't want it to be about weaponry or causing people problems. But when it comes to those that are supposedly the front lines and making sure that our loved ones have a fighting chance, both in the medical area, in their medical area, and their addiction area, as well as in their legal process, they're supposed to be advocates and support, not adding to the problem based on their own selfish agendas. And that's exactly what we're running into. And it is massively unfortunate and disheartening and angering. And for somebody like me, I'm not in a rage mode with them. I'm in a determined, long-term, going to deal with this mode. And I think that you should be too for your families. Now, my loved one is suffering tremendously. She has been abused in this system, and they'll find 1,000 reasons why what they're doing is right, and they'll blame her always. They'll say she did this or she did that, or she's breaking the rules or whatever. But when you come down what substance use disorder is and what's supposed to be treated, she's performing remarkably well, as documented by 2 different facilities with multiple reference letters. And at the same time, in their own program, they were progressing her through the program until they lied to a court system. And when they lied to that court system and got busted for it, now all of a sudden they're getting mean and making it worse. So I'm using all the resources I have, and one of those is my voice. So on here, I'm going to start exposing some of these things that I find. And I have a feeling the more that I dig into these things, not just with Barrington and not just with Carmen and Counselor T, and the house manager whose first name starts with a B, I'm not going to just stop with this. I mean, this is just an obvious tip of the iceberg, and we unfortunately are living proof that this is going on, and I'm not going to let it happen, and you shouldn't either. Just like you would in a long-term care facility if you found out your loved one was getting abused there, or if you did in a hospital, or if a CO was beating on your loved one and incarcerated, or if a cop beat up your loved one in handcuffs sitting in the back of a car. It doesn't matter what brought you there. It doesn't matter what legal process you even violated to get there. People that are in these positions, your job is to be above reproach, not hustle people, not play favorites, and not play stupid games, and certainly not be fraudulent in your billing practices. And all of those things appear to be happening in this facility. And so this is the first shot I'm firing on it. Guys, if you've got something going on in your area, question it, man. Don't just assume that your loved one, because they're a quote unquote addict or a junkie, are the ones at fault, because these treatment facilities will definitely, with all their alphabet soup after their name, are going to try to make you think that it is your person. And in many cases, it appears that's not the case. Some cases it is, but in many cases it's not. It's a tough balance. It's tough to find it. That's why it's hidden so well. For me, if I hadn't been so rigorous about it and followed the appropriate path and not just blown up and hadn't gone through and made sure that it was documented and understood exactly what it was before I spoke, I would have made a mistake, and they could have easily insulated themselves. Now that I'm exposing what I know, it's already too late. Everything's already exposed and will continue to be. The action is to come. But guys, this is serious stuff. I talk about addiction and what our personal accountability is and the things that we must do. For me as an addict, as an alcoholic, I have to do work on me. I cannot focus on what other people are doing to me. I have to do what is okay for me. But if you have a loved one that's in a treatment facility and they're being wronged against, yes, they need to focus on themselves. But if they're focusing on themselves, somebody has to advocate for them. If the very place they're going to get better is part of the problem, we have to advocate for them. And in this case, it's not only part of the problem, it's causing another trauma in this individual's life. And for me, I'm not going to stand for it. And you shouldn't either. So guys, join me with this one. Expose what you see. Don't just fuss over nonsense crap, but actually take some time and pause and see a pattern of behavior. Start asking questions and find out why it is that when legally they have the right or obligation to share certain information and don't. Why not? Well, as you'll find out in this case, as one of the other counselors in the facility told us, that they're inconsistent. They're all over the place. They're inconsistent. And that when my loved one tried to be discharged, she couldn't be discharged because there was no notes in her chart. None. But yet they apparently had all kinds of things to say to cause her problems with their kids. And now, because they got exposed for not putting notes in her chart and billing fraudulently, now they're taking it out on my loved one by putting her through absolute hell. Absolute hell. I'm not sure where we'll go with this. The system is, is tough, especially what we found ourselves in with our own choices that put ourselves in kind of a bad spot. Well, a really bad spot here. But, I have hope and belief because I know for sure what my loved one's doing, and I know for sure what I'm doing, and I know for sure what we need for our home. And, it's not based on some wild, crazy, like flip out accusation where I'm burning down the whole world. But I tell you what, man, we should not be standing by and allowing this crap to happen. Just as we're not going to stand by and let a bunch of COs in a prison here in New York beat people to death. Same thing. We cannot let people mentally beat people to death. They have mental health problems, especially if their primary diagnosis is depression. You don't do things to drive that further down through major isolation, sleep deprivation, manipulation, false accusations, no treatment plan, missed deadlines, changing deadlines, false narratives, all this stuff. What do you expect is going to happen even in a healthy mind? Nothing good. Guys, thanks for tuning in. Please like and subscribe. Help me get my voice out on this one. This is very serious to me. Should be very serious to you. They say the opioid crisis is the headline. We blame pharmaceutical companies for all kinds of things. We want to make sure treatment providers have the money they need to make sure they can support the patient population. And then when they get inside the doors, you have a bunch of scumbags treating people poorly. And at Barrington, they have a bunch of scumbags treating people poorly. And that will be exposed. It's already been exposed tonight, hasn't it? And hopefully, through the appropriate channels, we will have this addressed so that no other patient has to go through what my loved one did. Thanks for tuning in. Please like and subscribe, comment, and start spreading the word.